The Blood Center has lost hundreds of units of blood this week because of blood drive cancellations due to the COVID surge. Today, lawmakers on both sides of the state line helped out by making donations. KCTV5's Carolina Cruz shares more on the impact the low blood supply is having on the area.
Prior to the pandemic, 70% of the community blood center supply came from blood drives. High schools and colleges accounted for 25%. But with remote learning and work from home, it's created a vacuum in resources.
When that happens, it becomes very scary because the reality of the situation is that we're one large trauma away from being completely wiped out in our blood supply in Kansas City. And it's very alarming when we think about the patients outside of traumas and outside of emergency situations that still need blood products.
Chelsea Smith says they are constantly battling misconceptions, such as with vaccines. No matter what vaccine you get for COVID-19, you can still donate. With about 600 blood donations needed per week, the supply stands at a 1 to 2 day inventory, below the ideal 7 days. Representative Patty Lewis saw firsthand the impact donations make as a nurse working in ICU trauma centers.
In certain instances, like trauma cases, patients receive multiple transfusions to save their lives, and we are infusing it as fast as we can.
Donations help beyond the ER. Andrew White's mom, who was also a nurse, greatly benefited from donors.
In 2009, she was diagnosed with colon cancer, and she fought for almost 10 years. And she was an inspiration. And I want to do what I can to give back and remember her. Makes me feel closer to her.
He's hoping to lengthen the lives of other patients with his donations. He's been here nearly 60 times and encourages others to make an appointment and hopefully become regulars here. Reporting in Kansas City, Carolina Cruz, KCTV 5 News.